The screaming started before dawn in Vienna's first clinic. Another mother, feverish and writhing, her joy at childbirth, 3 days earlier, now transformed into agony as childbed fever consumed her body. Dr. Ignaz Semmelweis stood at the doorway of the ward in 1847, watching young women die at a rate that defied explanation. 1 floor below, the second clinic delivered just as many babies with a fraction of the deaths. The same building, the same food, the same air, yet 5 times as many mothers died upstairs. Medical textbooks blamed atmospheric disturbances, corrupted humors, or divine judgment. Semmelweis believed none of it. Something invisible was killing these women. Something the doctors themselves were carrying from bed to bed. The truth would make him a pariah, cost him his career, and drive him to madness. But for a few brilliant months, he would save hundreds of lives and discover a principle that would eventually revolutionize all of medicine. Ignaz Philipp Semmelweis was born on the 1st of July, 1818, in the Tab-Fanden district of Buda, a neighborhood of narrow streets and modest prosperity, where his father J. Fazef operated a successful grocery store. The 5th of 10 children, Ignaz grew up surrounded by the rhythms of commerce, learning early that hard work and careful observation determined success or failure. His father had risen from nothing to establish a thriving business, and he expected his sons to match his ambition. The Semmelweis family spoke Hungarian at home, attended Catholic Mass on Sundays, and navigated the complex ethnic tensions of the Habsburg Empire with practiced diplomacy. Buda was a Hungarian city under Austrian rule, where German remained the language of power and advancement. Young Ignaz learned to move between worlds, speaking Hungarian with family and German in formal settings, but this dual identity would mark him as an outsider in the rigidly hierarchical world of Viennese medicine. J. Fazef Semmelweis intended for Ignaz to study law, a respectable profession that would elevate the family's social standing. In 1837, Ignaz enrolled at the University of Vienna to begin legal studies, but the pull of medicine proved irresistible. Vienna was the capital of medical innovation, attracting the finest physicians and researchers from across Europe. The university's anatomical theaters drew students eager to study the human body through careful dissection and observation rather than ancient texts and speculation. Against his father's wishes, Semmelweis switched to medicine in 1838. He threw himself into anatomical studies with an intensity that impressed his professors. His Hungarian accent and merchant class background set him apart from the aristocratic Austrian students who dominated the medical faculty, but his skill with scalpel and microscope earned grudging respect. He learned to perform autopsies with meticulous precision, documenting every organ, every lesion, every deviation from normal anatomy. Semmelweis completed his medical degree in 1844 and sought a position that would allow him to continue research. After being rejected for a pathology position, he turned to obstetrics, viewing it as a temporary assignment. In July 1846, he became assistant to Professor Johann Klein in the maternity division of Vienna General Hospital. What he found there would haunt him for the rest of his life. The hospital's maternity wards overflowed with poor women who sought free medical care in exchange for allowing medical students to observe their deliveries. Most came from Vienna's desperately poor neighborhoods, many were unmarried, and all feared the whispered reputation of the first clinic as a place where mothers went to die. Vienna General Hospital's obstetric division operated 2 clinics that should have been identical. Both occupied the same building, used the same facilities, drew patients from the same population, and delivered roughly the same number of babies. Yet the mortality statistics told a story that defied every principle of medical understanding. The first clinic, where doctors and medical students provided care, recorded death rates that varied wildly, but averaged around 10%. In some months, the rate climbed above 15%. During the worst periods, nearly 1 in 5 mothers died within days of giving birth. The second clinic, staffed by midwives and midwifery students, rarely saw mortality exceed 2%. Women begged on their knees not to be assigned to the first clinic, knowing the assignment could be a death sentence. Semmelweis became obsessed with explaining the difference. He walked the wards at all hours, observing every detail of patient care. He measured room temperatures, examined ventilation systems, and studied the physical layout of both clinics. He investigated whether overcrowding in the first clinic contributed to higher mortality, but found no consistent correlation. He examined whether the birthing positions used by midwives differed from those used by doctors, but the techniques were essentially identical. The medical establishment offered explanations that satisfied no one. Some blamed cosmic atmospheric terrestrial influences that somehow affected only one clinic. Others suggested that rough examinations by medical students damaged maternal tissues more than the gentler care provided by midwives. The most popular theory held that emotional trauma caused the deaths. Women knew the first clinic's reputation, and their fear supposedly predisposed them to childbed fever. This explanation collapsed when Semmelweis noted that women assigned to the first clinic showed no symptoms until after delivery, despite their terror beforehand. Semmelweis studied every variable he could measure. He noted that the first clinic's priest walked through the maternity ward, ringing a bell before administering last rites to dying patients, passing directly by the beds of healthy new mothers. Could this psychological shock trigger disease? He convinced hospital authorities to change the priest's route. Mortality rates continued climbing. He examined whether diet contributed to the difference, but both clinics served identical meals. He investigated the quality of linens, finding no significant variation. He considered whether the time of day when examinations occurred mattered, discovering no pattern. Month after month, mothers continued dying at catastrophic rates in the first clinic, while the second clinic's patients survived. The puzzle consumed Semmelweis's waking hours and invaded his dreams. Somewhere in the difference between these two clinics lay a truth that could save thousands of lives, but every hypothesis collapsed under scrutiny. Then, in March 1847, his colleague and friend Professor Jakob Kolitschka suffered a minor accident that would illuminate everything. Professor Jakob Kolitschka supervised anatomy dissections with the same meticulous care he brought to all his teaching duties. On a routine morning in March 1847, he guided a medical student through an autopsy of a woman who had died from childbed fever. The student's scalpel slipped during the dissection, cutting Kolitschka's finger. The wound seemed trivial, the kind of minor injury that occurred regularly in Vienna's anatomical theaters. Kolitschka wrapped his finger and continued teaching. Within days, Kolitschka fell ill with symptoms that medical students recognized immediately: fever, chills, rapid pulse, profound weakness. His condition deteriorated rapidly despite every treatment his colleagues could provide. Less than a week after the scalpel wound, Kolitschka died. The autopsy revealed the same pathological findings seen in women who died from childbed fever: inflammation of the peritoneum, pus formation in the abdomen, and systemic infection that had overwhelmed his body's defenses. The death devastated Semmelweis personally, but it also triggered an intellectual revelation that would change his life. Kolitschka had developed and died from essentially the same disease that killed maternity patients, but he had never been pregnant and had never given birth. The only connection was the scalpel wound received during an autopsy of a childbed fever victim. Something from the corpse had entered Kolitschka's bloodstream through the cut, causing identical symptoms and identical death. Semmelweis's mind raced through the implications. Medical students in the first clinic spent their mornings performing autopsies in the dead house, dissecting corpses with their bare hands, then walked directly to the maternity ward to perform vaginal examinations on laboring women. They wiped their hands on their aprons between patients, but they never washed with soap or any disinfecting agent. The smell of putrefaction often lingered on their fingers when they examined pregnant women. Cadaveric particles became Semmelweis's term for the invisible material that doctors carried from the autopsy room to the delivery ward. These particles, when introduced into the raw wounds of the birth canal and uterus, caused the same deadly infection that had killed Kolitschka. The doctors themselves were the vectors of death, their unwashed hands spreading infection from corpse to living patient with every examination. The theory explained everything. Midwives in the second clinic performed no autopsies and handled no cadaveric material, which explained their dramatically lower mortality rates. The first clinic's death rates spiked when medical students performed the most autopsies and fell during vacation periods when students left Vienna. Women who delivered quickly before medical students could perform repeated examinations survived at higher rates than those subjected to multiple invasive checks by unwashed hands. The revelation was both brilliant and horrifying. Semmelweis realized that Vienna's most respected obstetricians, his own supervisors and colleagues, were inadvertently killing their patients through ignorance. Doctors took pride in their blood-stained aprons as symbols of hard work and experience, never suspecting that the dried blood and tissue represented deadly contamination. In May 1847, Semmelweis implemented a policy that was radical in its simplicity. Every doctor and medical student entering the maternity ward must first wash their hands in a solution of chlorinated lime until the cadaveric smell disappeared. The disinfecting station stood at the entrance to the first clinic, a basin filled with calcium hypochlorite solution that burned the skin but destroyed the invisible particles of death. The medical students grumbled at the new requirement. Washing hands between every patient examination consumed time and caused skin irritation. Some considered the policy an implicit accusation that they were somehow unclean or unprofessional, but Semmelweis insisted with an intensity that bordered on obsession. Every hand must be washed thoroughly before every patient contact. No exceptions. The results appeared within weeks. Mortality in the first clinic dropped from over 18% in April 1847 to less than 2% in June. Month after month, the statistics confirmed what Semmelweis had discovered. When doctors washed their hands in chlorinated lime solution, mothers stopped dying at catastrophic rates. The difference between the first and second clinics vanished. Handwashing had eliminated the death rate disparity that had baffled Vienna's medical establishment for years. Semmelweis documented every death, every delivery, every monthly mortality rate with obsessive precision. His statistics were irrefutable in 1846. Before hand-washing protocols, the first clinic recorded 459 maternal deaths among 4,010 deliveries, a mortality rate of 11.4%. In 1848, after implementation of chlorinated lime washing, only 45 mothers died among 3,556 deliveries, reducing mortality to 1.3%. The data represented thousands of women who went home to their families instead of dying in fever and agony. The evidence extended beyond mortality statistics. Semmelweis observed that women who delivered before reaching the hospital, giving birth in the street or at home without any medical examination, almost never developed childbed fever. This street birth survival rate had previously been attributed to fresh air or divine providence. Semmelweis understood the real reason. These women's birth canals were never contaminated by doctors' unwashed hands carrying cadaveric particles. He expanded his theory beyond autopsy material. Any putrid organic matter could cause infection if introduced into wounds. Doctors who examined patients with suppurating wounds and then moved directly to examine maternity patients without washing spread infection even without visiting the deadhouse. The principle was universal. Contaminated hands spread disease, and disinfection prevented transmission. Semmelweis had discovered antisepsis decades before Louis Pasteur would provide the theoretical framework of germ theory to explain it. He had proven through rigorous statistical analysis that simple hand-washing could prevent a disease that killed thousands of women annually. He had solved one of obstetrics' greatest mysteries and handed his colleagues a tool to save countless lives. The medical establishment's response would break him. Professor Johann Klein, Semmelweis's direct supervisor, reacted to the hand-washing policy with barely concealed hostility. Klein had directed the first clinic during the years of highest mortality, and Semmelweis's theory implicitly accused him of killing patients through ignorance. Klein refused to publicly acknowledge that hand-washing reduced mortality, despite the statistical evidence compiled under his own supervision. He began undermining Semmelweis in faculty meetings and administrative discussions. Vienna's senior obstetricians united against the Hungarian upstart, who dared suggest that prestigious physicians were somehow unclean. Dr. Karl Braun, who would eventually succeed Klein as director, dismissed the cadaveric particle theory as unscientific speculation. How could invisible material cause disease? The dominant medical theory held that miasmas, corrupted atmospheric vapors, caused childbed fever. Semmelweis's particles had never been seen under a microscope and violated established scientific understanding. The accusation of being murderers struck at the core of medical identity. Physicians saw themselves as healers, educated gentlemen who brought science and compassion to suffering patients. Semmelweis's theory suggested they had been killing the very women they sought to save, that their hands carried death rather than healing. The psychological burden of accepting such guilt was too heavy for most doctors to bear, especially without a theoretical framework to explain the mechanism of invisible transmission. Critics attacked Semmelweis's statistics as fraudulent or misinterpreted. They argued that the mortality decline coincided with improved ventilation in the hospital or seasonal variations in atmospheric conditions. Some claimed that the apparent success resulted from Semmelweis's increased vigilance and better patient selection rather than hand-washing itself. Every possible explanation was explored except the obvious one. Chlorinated lime disinfection worked because it killed infectious material on doctors' hands. The scientific community demanded explanation of the mechanism before accepting empirical results. What exactly were these cadaveric particles? How did they cause disease? Why did chlorinated lime neutralize them while soap and water alone proved less effective? Semmelweis could not answer these questions because microbiology had not yet discovered bacteria. He knew his treatment worked but could not explain why in terms that satisfied the theoretical requirements of contemporary medical science. Professional jealousy and ethnic prejudice compounded the resistance. Semmelweis was Hungarian, not Austrian, from merchant class rather than aristocracy, trained in Vienna but never fully accepted by its medical elite. His personality, abrasive and uncompromising, made enemies even among those who might have supported his findings. He demanded immediate adoption of hand-washing protocols without bothering to convince or persuade, treating opposition as evidence of stupidity or malice rather than legitimate scientific skepticism. The international medical community proved equally resistant. When colleagues in other European cities tested hand-washing and reported mixed results, Semmelweis attributed failures to improper technique rather than flaws in his theory. He insisted that only chlorinated lime solution provided adequate disinfection, rejecting reports that soap washing showed minimal benefit. His inflexibility and inability to communicate his methods clearly prevented widespread adoption of practices that could have saved thousands of lives across Europe. By 1849, Semmelweis's position in Vienna had become untenable. Professor Klein refused to renew his assistant position, effectively ending his career at Vienna General Hospital. Political turmoil from the 1848 revolutions that swept through the Habsburg Empire provided convenient cover for what was fundamentally a professional purge. The Hungarian who had challenged Vienna's medical establishment was sent home in disgrace. Semmelweis returned to Budapest in 1850, a broken man returning to provincial medicine after tasting the intellectual excitement of Imperial Vienna. He spent nearly 2 years in relative obscurity, taking a position at a small hospital while battling depression and professional isolation. The humiliation of rejection, combined with the knowledge that women continued dying from preventable infections throughout Europe, drove him deeper into bitterness. In 1851, Semmelweis married Maria Weidenhofer, a 19-year-old woman from a respectable commercial family. The marriage brought stability and produced 5 children, but Maria struggled to understand her husband's obsessive focus on childbed fever and his growing anger at the medical establishment. Home life offered no escape from the mission that consumed him. His professional fortunes improved in 1855 when he was appointed head of the obstetric department at St. Rochus Hospital in Pest. The position gave Semmelweis another opportunity to implement hand-washing protocols and prove their effectiveness. Once again, the results were spectacular. Mortality rates plummeted when strict disinfection procedures were enforced. Over 6 years at St. Rochus, maternal mortality remained below 1%, providing additional statistical confirmation of his theory. But success in Budapest did little to change minds elsewhere. While Semmelweis saved lives in his own hospital, thousands of women continued dying in maternity wards across Europe, where doctors refused to adopt antiseptic practices. The knowledge that simple hand-washing could prevent these deaths, combined with the medical establishment's stubborn resistance, transformed Semmelweis's frustration into rage. He began writing his definitive work, The Etiology, Concept, and Prophylaxis of Childbed Fever, published in 1861. The book presented comprehensive statistical evidence supporting his theory and detailed instructions for preventing puerperal infection. But the writing reflected Semmelweis's deteriorating mental state. Alongside careful documentation, he included bitter attacks on colleagues who had rejected his findings. The tone alternated between scientific precision and personal vendetta, undermining the book's credibility among the very audience he needed to convince. Publication of the book marked Semmelweis's transition from scientific advocate to crusader consumed by righteous anger. He could no longer maintain the professional detachment expected in medical discourse. Every mother who died from childbed fever represented a personal failure and a moral crime committed by the doctors who refused to wash their hands. The weight of preventable deaths crushed his ability to engage diplomatically with critics. His behavior grew increasingly erratic. Colleagues noted mood swings, paranoid accusations, and inability to focus on routine medical duties. Whether the mental deterioration resulted from neurosyphilis, early-onset dementia, or the psychological trauma of watching his life's work rejected, Semmelweis was losing control of both his emotions and his advocacy. In 1861 and 1862, Semmelweis published a series of open letters to prominent European obstetricians that destroyed any remaining sympathy for his cause. The letters abandoned scientific argument in favor of personal attacks and moral condemnation. He called his critics murderers, accused them of willful ignorance that killed thousands of women, and demanded they acknowledge their guilt in the ongoing tragedy of childbed fever. Professor Karl Braun, now directing Vienna's first clinic, received particularly venomous treatment. Semmelweis wrote that Braun had blood on his hands and compared him to a criminal who knowingly commits murder. He addressed the letter to Herr Hofrath Professor Dr. Braun in Vienna, murderer of mothers. Such rhetoric guaranteed that Braun and his supporters would never consider Semmelweis's scientific claims on their merits. The open letter to Professor Friedrich Scanzoni at Würzburg University exemplified Semmelweis's descent into counterproductive rage. Scanzoni had actually implemented some hand-washing procedures, but reported mixed results. Rather than engaging constructively to improve techniques, Semmelweis accused Scanzoni of incompetence and dishonesty. He wrote that doctors who failed to prevent childbed fever through proper disinfection were ignoramuses who had blood guilt for every maternal death. Medical journals refused to publish his letters, viewing them as unprofessional rants rather than scientific discourse. Semmelweis paid for private publication and distribution, spending his own money to send copies to obstetricians across Europe. Recipients were appalled rather than convinced. Friends and supporters begged Semmelweis to moderate his tone and focus on scientific persuasion rather than moral accusation. Ferdinand Hebra, one of Vienna's most respected dermatologists who had supported Semmelweis's work, watched helplessly as the man destroyed his own credibility through intemperate attacks. Hebra understood that medicine changes slowly, that established practitioners resist revolutionary ideas regardless of evidence, and that patient coalition building achieves more than furious denunciation. Semmelweis understood none of this. The tragedy of the open letters lies not in their content but in their consequences. Everything Semmelweis wrote was essentially true. Doctors were killing patients through ignorance. The refusal to adopt proven preventive measures did constitute a kind of moral failure, but truth delivered with rage and contempt achieves nothing except alienation. Semmelweis's open letters ensured that adoption of antiseptic practices would be delayed by years, costing thousands of additional lives. By early 1865, Ignaz Semmelweis showed unmistakable signs of severe mental deterioration. His behavior at St. Rochus Hospital became erratic and sometimes violent. He made inappropriate remarks to staff and patients, forgot basic medical procedures, and expressed paranoid beliefs about conspiracies against him. His family watched helplessly as the man they knew disappeared into confusion and rage. In July 1865, colleagues and family members decided that Semmelweis required institutional care. They deceived him into traveling to Vienna under the pretense of visiting a new medical facility. Upon arrival, he was forcibly committed to a mental asylum. Semmelweis realized the deception immediately and fought violently against the asylum guards who restrained him. The guards beat Semmelweis severely during his commitment. He sustained multiple injuries, including wounds to his hands and possibly head trauma. Confined to the asylum under brutal conditions typical of 19th century psychiatric care, his physical and mental condition rapidly declined. Infection developed in his wounds, causing the same symptoms of septicemia that he had spent his career preventing in maternity patients. On the 13th of August, 1865, just 2 weeks after his commitment, Ignaz Semmelweis died at age 47. The official cause was pneumonia, the systemic blood infection resulting from contaminated wounds. The autopsy revealed extensive gangrenous infection, multiple abscesses, and the kind of overwhelming sepsis that could have been prevented by the antiseptic principles Semmelweis had discovered. The man who proved that clean hands save lives died from an infection caused by dirty hands that beat and restrained him. Ignaz Semmelweis died in obscurity and disgrace in August 1865, his theories rejected, his reputation destroyed by his own rage. Within a decade, everything changed, though too late to save him from tragedy. Louis Pasteur's germ theory in the 1860s provided the framework Semmelweis had lacked. Joseph Lister's antiseptic surgery techniques proved that invisible contamination caused disease and disinfection prevented transmission. By the 1870s, European medical schools routinely taught principles that Semmelweis had discovered through observation alone. Maternal mortality from childbed fever plummeted wherever proper hygiene was enforced. Vienna General Hospital eventually erected memorials celebrating the man they had driven away. The savior of mothers received posthumous recognition as one of medicine's great pioneers, though no praise could undo his suffering. Semmelweis discovered a truth so profound it revolutionized healthcare and saved millions of lives. But he lived before science could explain invisible disease transmission, and he lacked the temperament to bridge empirical observation and theoretical acceptance. His story stands as medicine's most tragic reminder that revolutionary ideas require not just brilliant insight, but patience, diplomacy, and cultural readiness. Today, every hand washed before patient contact honors the Hungarian physician who died proving a simple truth. The hands that heal must first be clean. Semmelweis paid with his career, sanity, and life. Medicine learned the lesson, though thousands died before doctors admitted the stubborn outsider had been right all along.